Video Lecture Module 17. First, the visible outer ear channels the sound waves through the auditory canal to the eardrum. The middle ear transmits the eardrum's vibrations through a piston made of 3 tiny bones to the cochlea in the inner ear. Ripples occur in the basilar membrane, bending hair cells lining its surface. Hair cells trigger impulses in adjacent nerve cells, whose axons converge to form the auditory nerve, which send the message to the temporal lobe's auditory cortex. Most hearing loss is caused by damage to hair cells. Likened to shag carpet fibers, you walk on them and they spring back. But if you leave something heavy on them for a long time, they will never rebound. As a general rule, if we cannot talk over a noise, it is potentially harmful if you are exposed to it for prolonged periods of time and repeatedly. Sounds usually reach one ear sooner than the other. The brain uses this difference to generate a perception of the direction the sound was coming from. Time differences as small as 1/100,000th of a second can cause us to localize sound. The head acts as partial sound barrier, creating a shadow in which sounds are delayed and not as loud. Touch is valuable for expressing and sensing feelings, for sharing affection, comfort, and support, for detecting the environment in multiple ways, such as pressure, warmth, cold, and pain. Infant rats deprived of their mother's grooming produce less growth hormone and have a lower metabolic rate. Infant monkeys allowed to see, hear, and smell but not touch their mother become very unhappy. Premature human babies gain weight faster and go home sooner if they are stimulated by hand massage. Even strangers touching only their forearms and separated by a curtain can communicate anger, fear, disgust, love, gratitude, and sympathy at levels well above chance. Pain tells the body that something has gone wrong. Pain often warns of severe injury or even just to shift positions in a chair to keep blood flowing. Gate control theory states that the spinal cord contains a neurological gate that blocks pain signals or allows them to pass on to the brain. Stimulating large nerve fibers in the spinal cord through acupuncture, massage, or electrical stimulation seems to close that gate. Endorphins can be released by the body to reduce pain perception. Perhaps you have injured yourself while playing a sport, but didn't notice the pain until you actually looked at the injury. Part of the reason this happened was because you were releasing endorphins. As the brain produces false sounds, tinnitus, ear ringing, and sights like auras that you might see during migraines, it can produce pain or other perceptions of amputated, missing arms or legs, and this is called phantom limb sensation. Recent research involving bending an unseen real finger and hurting a finger on a visible fake rubber hand shows that pain is not just physical, but also has a psychological component. We typically remember our peak experience of pain and how much pain we felt at the time. A physician used this principle with patients undergoing colon exams, lengthening the discomfort by a minute but lessening its intensity. Although the extended milder discomfort added to their net pain experience, patients who perceived this tapered down treatment later recalled the exam as less painful. Pain can be reduced through drugs, acupuncture, electrical stimulation, exercise, hypnosis, surgery, relaxation training, and distraction. Even the placebo effect has real influence on pain perception. When we think we are taking painkillers or receiving acupuncture, our bodies can release endorphins. Distraction with virtual reality has helped burn victims manage intense pain.